And now that we're recording, I'm going to say, hey, Better, Richer, Stronger, we are back. Earlier this afternoon, we had the pleasure of working with Rob Montgomery, who is a lawyer who specializes in dentistry. But I'm talking now with my friend Jessica Metcalfe up in Canada. And Jessica and I have some very, very important work to do. And you're going to be hearing a lot of this on Better, Richer, Stronger, because this is likely the most important work I and Jessica are going to be doing together and separately for the Dental Mental Network. Ladies and gentlemen, please listen up to this and please tell your friends to listen to this. This stuff could save your career or save your life. Jessica, thanks for coming on with me. It's always good to see you. And in July, we're actually going to do some great big hugs together instead of this 2D stuff.
Yeah, in person. I'm excited.
Yeah. Jess, you run the Alchemy Academy. You have a podcast that you had me on a while ago called The Dark Side of Dentistry.
Mm-hmm.
And that's not when your operatory light goes out. But Jess, tell us a little bit about Alchemy Academy, and tell us a little bit about the podcast so people know who you are and what you do, and then we'll get into what we are doing together.
Yeah. So Alchemy Academy, I started a few years ago because I went looking for something that I felt didn't exist within dentistry. And so I thought, well, if it doesn't exist, I'm going to create it. And at that point in time, I was in such a deep, dark hole because of where I was mentally, emotionally, spiritually, and physically. And during that time, I had to really navigate changes because the way that I was going wasn't sustainable long term. I was working 6 to 7 days a week. I was overextending myself. I underestimated my abilities. I wasn't confident in my own skin. And looking at social media or at conferences, I kept comparing myself to others, and I felt like I was behind all the time. And I had some personal things going on at the same time in regards to family. And then I essentially hit my breaking point. And that's when I was diagnosed with clinical depression, a generalized anxiety disorder, and was experiencing burnout.
Oh
And
my.
it was one of those things where I didn't see a way out. And when I finally started to get the help and I started to navigate and make changes, a big burning question of mine was, well, why do we experience what we experience within dentistry? And that had me stumbling upon research after research after research. And then I said, why isn't this information being broadcasted to the dental community? And that's how Alchemy Academy came into fruition, because I wanted to get information out to the dental community, and I love teaching. So it was very natural for me to start a coaching business where I now have a self-directed course, group coaching, one-on-one coaching, and I've now expanded to clinics to help with effective communication, workplace culture, and mental well-being. Because you can't just go in and continually take care of others without making yourself a priority. And
Yes.
we tell our patients all the time, don't wait until you're symptomatic to come and see us. Usually at that point, it's too late, or you're way down the line in regards to treatment suggestions. So why do we wait until we're symptomatic to take care of ourselves?
Yes. Yeah. It's the classic air travel thing. If the mask pops down, put it on yourself first, and then take care of the child that may be sitting next to you. If we're not strong, who are we going to help? If we're not healthy, how are we going to spread health? And Jess, you tripped upon several points that so many of us in dentistry trip upon: the comparison, the expectation of perfection, the expectation that this career is going to do it all for you, the expectation that if you're not happy, you can do a career or do something to make you happy.
Mhm.
And wisely enough, you found help,
Mhm.
as I did. This is not a female thing. This is a human thing. And I think, what I'm going to be doing is addressing the gentlemen of dentistry and the people who have gentlemen in dentistry that they care about. I admire a lot of things that you 2X chromosome types do, that you're able to get this out so much easier than we Y chromosomes do, except for me, of course. I'll talk about anything. And frankly, my ability to confront those problems and look them in the eye and admit that I had them really made me better, richer, and stronger.
Yeah.
And I think, Brene Brown writes about this, and we're all versed in her work right now. But this vulnerability is strength thing is really important. It's really true.
It's interesting that you say that from a woman's perspective, where it appears to be easier. And I want to offer a different perspective is when
Please.
you're in a profession that has a bunch of high achievers and that has been known to be male dominated. I understand that classes are 50-50 at this point. However, there are still organizations and societies where it's still swung one way. And so from the female perspective coming in, you feel like you have to have this front, that you have to come across, right? And because of that, anytime you feel as if you want to be vulnerable, you close that door, because then there's the potential of being perceived as quote unquote weak. And that's
Fake news.
right. And that is really hard to navigate. So now let's put this both to men and women, and the whole quote unquote weak by sharing emotions or vulnerability. It doesn't make you weak. Asking for help doesn't make you weak. And so what I like to do is to change people's perspective by offering a way to think of it differently. So for example, let's go to the asking for help. It's not because you're weak or that you have a weakness. It's because your strengths and your wants are elsewhere. So why not outsource and ask for that help in areas where they are now using their strengths? Right? They get to step in and be able to take something off of your plate. So then you get to go and do what you are good at, what you like doing. And so if we can start to change that perspective, start to change how we choose to view ourselves, start to change how we choose to speak to ourselves, then being vulnerable doesn't have to appear as being weak.
Right. And how many of the leaders of dentistry, the people we all look up to, have you spoken to intimately in a quiet setting who are carrying stuff? Tons of them.
Yeah.
We're all carrying things. And it's not to say this is the be all end all of our existence, but it's something where we can find strength. We can beef it up and we can make it better. That's what you're about. That's what I'm about. And that's the work that we want to do in the Dental Mental Network in Nashville in July. Doing all this for, addressing a very serious problem with smiles on our faces, with hope in our hearts, in an atmosphere that's going to be one big party. It's going to be fun, but it's going to be dead serious. Tell us, please, Jess, what you will be doing for Dental Mental Network. Just give us an idea of what you're going to be going over.
Yeah. Oh my goodness. So I'm so excited. So something that I just touched on is around changing your inner voice and how you choose to speak to yourself. And that is a huge proponent of the work that I do, is around reframing your thoughts and reframing how you choose to see yourself. So what I'll be talking on is imposter syndrome and perfectionism at in Nashville in July for the Mental Dental Network, because with each one of us, we have you as a speaker, me as a speaker, all the other wonderful speakers who are going to be talking. Everyone has that topic that is so near and dear to their hearts that they want to be able to communicate to the rest of the world. And so for me, it's imposter syndrome and perfectionism, and the link on how it's affecting us within dentistry.
Yeah. Can I crash your party, by the way?
Yeah. You're welcome. There's no need to crash. You're invited.
All right, good. because you hit me in the heart with those comments as well, because these are the things that hampered my career early on until I figured it out.
Mhm.
And my good friend Frank King is going to join me, the mental health comedian and suicide survivor, who's dedicated his career also to relieving misery. And we have found that the dental profession needs the two of us, his perspective on suicide prevention and causes and what to do about it if you're going down that hole, and my perspective from suffering from, you've heard me talk about PMD, right? Perpetually miserable dentist, PMD syndrome, and how I got rid of it and how I use my dentistry now as a source of happiness and joy. And so I can enjoy the ride. And I think, Jess, we're endowed with the inalienable rights of life, liberty, and the pursuit of happiness, at least here in America. You in Canada, you have your own stuff, your own rights that you have up there. But, if we can't be happy, if we're miserable and we have money out of the wazoo, endless supply of money, what good is that? The happiness, it has to be your foundation.
Mhm.
We know plenty of people who are pursuing dollars blindly. And where does that lead us? Down the wormhole.
Mhm.
So you were brave enough and bold enough to confront this problem and address it for yourself, and now you're spreading the wisdom to the world.
Mhm. That's why the podcast came into being, because I wanted to have a space where not just myself could share my story, but others could share their stories as well who felt comfortable with sharing, like yourself.
Yeah.
And when we can step into that space of recognizing we're not alone in this and that we can resonate with what others are saying,
Yes.
then we can ask for the help and that we know that something's not wrong with us. And that helps build community, that helps build your confidence back up in yourself. And so that podcast, probably out of selfish reasons, so then I knew I wouldn't be alone either, came into fruition. So it was a platform for others to share that stage. And the more that we share, the more that people can navigate their own stories, whether or not they feel comfortable sharing at that point in time, but they can be given information to take those next steps.
Yeah. And what's so important that you and I hang out in the same Facebook groups and see the same things going on. And we, unfortunately, it's a loud minority, but we see a loud minority of dentists shooting at other dentists. And I've been cursed at. Um,
Me too.
yep, yeah, these people curse at me and they don't realize that I'm from New Jersey. I could give it right back to them and then some, but I don't. Um, but why? And you and I are building communities of support where if you sprain your dental Achilles heel, you have trainers like you and me, and a lot of our other friends like Sue and Laura Brenner, Sue Jeffries and Laura Brenner, Claudia Lovato will be with us, and of course Frank. We are going to be helping you and letting you know that being imperfect is a part of life, and you can be happy and imperfect at the same time. You don't
Yeah.
have to think about throwing the baby out with the bathwater, God forbid, and just making your life a little bit better with a little help from your friends.
Yeah. Yeah.
That's all it is. So you and I are going to be teaming up.
Yes.
Yeah. And I'd like all of you, well, as many of you as you can, to get down to Nashville and visit us at the Dental Mental Network. If you buy a ticket to Dental Mental Network, you can get into 18 different conferences. Our friend Elijah Desmond, who is the biggest thinker, his thinking is as big as he is, which is pretty big. Elijah's put together a string, a dozen and a half or so dental conferences under one roof. You get your CE, You get a nice hotel in Nashville, and he's got some fun planned also. Come down and hang out with us. One of us will touch you. One of our messages will resonate with you and will make your life so much better.
Mhm.
Jessica, take a parting shot.
Oh man, I want you to know that by you choosing to come to Nashville, that we started this conversation saying that it's just as important to choose you. And that's what you're doing, is recognizing that you can take the time to learn how to take care of you. You spent years taking care of other people. It is time to take care of you.
Yes, it is. We have clinical CE, we have management CE. We don't have this.
Yes.
And my friend Uche Odiatu talks about eating right and exercising. I talk about eating and exercising. We have that, but we've got to take care of the control center here. We've
Mhm.
got to direct ourselves properly. And people like you, Jessica, are making the world better.
Thank you.
I
Thank you.
cannot thank you enough for that. Jessica, will you come back again before we do this thing? Because we got to saturate the world of dentistry with this thing.
Yeah,
We
I'm
do.
down.
All right. No, you're sitting. All right,
Sitting
Jessica.
down.
I'm sorry, I can't help it. And if you think this is bad, wait till you see Frank, a professional comedian, me, an amateur comedian, getting together, talking about something very, very serious. We will make it pleasant. We'll all make it interactive and fun and lively. We're all a batch of people who've come out of dark spaces, and we
Yeah.
want to take you there with us, see the light with us, and let's make life better for ourselves as we make life better for everybody else.
Mhm.
So stay with me a second, Jess. Everybody have a great evening. Eat well. Get some sleep. Get 7 hours of sleep. Get your cardio. Get your weight training done. Make somebody's life better each and every day, because that makes us feel great as we make others feel great. And that way you can enjoy the ride. I will be back very soon with some more outstanding continuing education available here that you can't get anywhere else. So stay with me. Thanks for being with me. Jess, hang on. I'll talk to you in a minute. Have a great night, folks.